Dr. Fiona Lithander. So our next speaker is joining us all the way from New Zealand, across the ditch. Dr. Fiona Lithander is an Associate Professor and the Associate Director of Research at the Liggins Institute, University of Auckland. And what she is going to talk to us today about is keeping us all grounded in what to eat, why it matters, and what the evidence actually shows us in support of people living with Parkinson's. So this is going to be really, really interesting. She is live at the moment. She's going to be on every screen around the building so you can all see her. Ladies and gentlemen, please join me in welcoming all the way to the Sunshine Coast from Auckland, New Zealand, Dr. Fiona Lithander via Zoom.
Thank you very much for the kind introduction. I wonder if somebody could confirm that you can hear me okay. Yes, okay. Oh, I'm absolutely delighted to join the conference on the Sunshine Coast. I would love to be there with you all this afternoon, especially for that coronation chicken sandwich. It sounds just delicious, just what you want to have for your lunch. But I'm really, really excited to join you by Zoom for this meeting. So I want to extend my thank you in particular to Tricia. We've spoken on the phone and we've put together today's presentation. So I'm hopeful that by the end of it, you'll certainly have 3 key points that you can take away and put into action. And I'm going to remind you of those as we go through the presentation. So the plan is that I've got until 2:25. So I'm going to speak for about 25-30 minutes and then open the floor to questions. And I believe the MC or one of your colleagues is going to go around with a microphone. And I'm very happy to answer any questions that you have. So please feel free as you go to jot them down or keep them in your mind. And I'll happily answer the questions at the end, anything that comes up. Things that even don't come up in today's talk, because it's kind of hard to fit everything in a short 25-minute talk. But anything else you can think of related to nutrition, I'm very happy to answer it for you. So as the person who introduced me said, I'm based at the University of Auckland in New Zealand. You can probably tell from my accent that I'm not a Kiwi. I'm from Ireland originally. And would you believe that I did live in Australia? I lived in Australia for a number of years, and I'm a dietitian. I'm a nutrition scientist as well, but I actually did my training to be a dietitian in Australia, in New South Wales. So Australia holds a really close place in my heart, and all of the information I've got for you today is very much relevant to you and also applicable to what I know about the food that's available to you in Australia. So I want to just start by telling you some really good news. Our medical community, the neurologists that look after you, the geriatricians, the GPs, are really, really turning their attention to nutrition, to other lifestyle factors like physical activity and sleep. So there was a piece of an editorial published just at the end of last year by 2 of the biggest hitters in the Parkinson space. So the principal medical advisor, Rachel, principal medical advisor in the Michael J. Fox Foundation, and then Professor Jennifer Goleman, who's a neurology doctor in the States. And they and others are really beginning to turn their attention towards nutrition, physical activity, sleep, occupational therapy, speech and language therapy, because we know that for many years, the medical treatment or the medicine that many of you take for Parkinson's is levodopa, and that whilst there's amazing research ongoing, we know that there hasn't been any new research in many decades that helps with your progression of Parkinson's, because levodopa, as we know, just manages the symptoms. So really, I guess I want to highlight right from the get-go that the lens is being placed on these other really important things, including nutrition. And just to highlight that a little bit further, you know that people like me, I'm a researcher based at the University of Auckland. We write these research papers, but I want to highlight just on this slide that when we look at the database, it's called PubMed, where all the research papers are published in the area of biomedical science, you can see that research papers and research articles in nutrition and Parkinson's, you can see that they've increased significantly from the early 1960s up till now to 2025. So again, highlighting the growing interest and the importance of nutrition in Parkinson's. So really starting out with the real big note of hope, because I think that's really important. So the key things I'm going to talk about today are on this slide. And again, I just want to draw your attention to remember those 3 key points that I want you to take away from today. I'm going to talk about them at the end, but there's no reason why you can't take away tips on weight and dietary protein and fiber, those sorts of things. So I'm going to start with weight, and I want to highlight to you why it's important to maintain or stay a healthy weight when you have Parkinson's. And in particular, I want to highlight this because many people who have Parkinson's begin to lose weight. So the research shows that people who have a lower body mass index, body mass index is kind of the ratio between your weight and your height, but people who have Parkinson's tend to have a lower weight and a lower body mass index than people without Parkinson's, number one. And we know that a low weight isn't great when you have Parkinson's. So it can increase your risk of a variety of things, such as malnutrition. It can reduce your quality of life. Your Parkinson's symptoms can be more severe. Your cognitive symptoms, so your brain symptoms can be worsened as you lose weight. And as I say, we know that weight loss happens. A number of studies have actually compared people with Parkinson's to without Parkinson's. We ourselves did a big study. I'm still working with some people in the UK, and we recruited hundreds and hundreds of people with Parkinson's and measured them over time. And what we found was that sort of 3 or 4 years after diagnosis is when weight tends to fall. So it is important to see if there are any tips, and I've got lots of tips for you on the next few slides, and I just want to highlight why it is important for you to stay the same weight and not to lose weight, because that is something that we often see in Parkinson's. So why do we see weight loss in Parkinson's? Well, all sorts of reasons, as you can see on my screen. So often many of the medications that you've been given can cause, nausea and vomiting, diarrhea, constipation, dry mouth, tiredness, and all of these things are really unpleasant for you. And it's no wonder that people don't want to eat as much if you've got these various side effects of medication. So what I want you to do is, if you notice any of these things, if you've got any of, dry mouth or excessive tiredness, etc., do raise these with your GP, because it may be affecting your ability to eat and therefore may be leading to some of that weight loss. Many people with Parkinson's have difficulty chewing or difficulty swallowing. There are other things that can happen in Parkinson's, and again, that can contribute to weight loss. Increased movement, so as Parkinson's progresses, tremor, involuntary movement, so can actually contribute to just simply burning more energy, therefore weight can be lost. And then there's all the practical problems, such as shopping for food can become more difficult, preparing food, and even when you have prepared a meal, maybe a hot meal, keeping it warm through the duration of that meal can be a little bit more challenging, and therefore if it gets a bit cold, you may be less likely to eat it, because it might be as good if it's gone lukewarm or a bit cold. So these are the sort of causes of weight loss in Parkinson's. These are the sorts of things that can really sort of affect how much and the quality of what you eat. So if you're losing weight, I just have a few tips here for you. So in addition to considering ensuring that you have sort of your 3 meals a day, and one of the questions when all of you are registering to attend today, one of the questions I got was, is it a good idea to skip meals? And I would say, do your best not to skip meals if you can. And of course, sometimes life gets in the way and you're out and about and it can become a challenge. But especially if you notice that you're losing weight, having really trying to pay attention to have your meals and having some snacks between your meals. And if you find that sometimes you're feeling excessively full. So, because what can happen in people with Parkinson's, your appetite can change and you might say, oh, I feel a little bit full. I don't really want to eat a snack between lunch and dinner. You could have a snack that's a liquid snack, because sometimes liquid snacks are a bit more appetizing. So something like a milky drink is what I've got in the slide, a smoothie. So you could make that yourself at home with some milk and some yogurt, maybe put some frozen berries in it or something. And you could make yourself a smoothie, and even having a few mouthfuls will help contribute to giving you more calories, therefore help you with losing weight. And then some people say, oh, I don't want to have to eat bigger portions, but little tricks like putting some extra butter or some extra cheese in your, I don't know, if you might have some mashed potato or something like that, or putting some gravy on your meat. I know many of you probably do that already because it can help with swallowing. So there are some tricks that you can use. I'm very happy in the question and answer session to talk through additional snacks if that would be helpful. Now, some of you may not have weighing scales at home, and I fully understand that may be the case, but you may notice the waistline of your trousers or the waistline of your skirt getting a little bit loose, or sometimes you notice maybe the jewelry, your watch or your rings, or some people might pass comment and say, gosh, I haven't seen you for a while, have you lost weight? So again, I just hope I've highlighted the importance of that. Some people carry extra weight, and you might now begin to say, well, how do I know if I'm a healthy weight or not? Your GP will tell you. And I do encourage you, next time you go to your GP, whether it's Parkinson's related or not, ask them to weigh you. Ask your GP or the nurse at your GP practice. And when you go to see your Parkinson's specialist, your Parkinson's doctor or nurse, ask them to weigh you. And again, that means by weighing you, they can look at changes over time. So in terms of what's a healthy weight and what's a less healthy weight for you, speak to your healthcare provider and they'll be able to tell you what that is. So just back to my current slide, I'm a little overweight. What can I do? Well, you can maybe change your cooking method. So for instance, use the grill or the microwave, or bake or steam instead of frying. We all love some cakes or biscuits, and that's fine on occasion, but on a regular basis, those foods are quite high in fat and sugar. So things like yogurt, nuts, fruit instead of cakes or biscuits, and swapping sugary drinks for the sugar-free alternative. So they're just some suggestions if you feel you're carrying a little bit of extra weight. But additionally, do chat to your GP about that, and they'll have a look to see whether you're in the correct range. But as I say, losing weight over time is something that happens in Parkinson's, and we want to avoid that for the reasons I described a few minutes ago. So I'm going to move on to the next point of the 5 things to discuss. And again, this came up quite a bit when you were registering for the conference in terms of sort of questions for me. So I thought it would be useful to have a look at that. So many foods that we eat and many drinks that we consume contain protein. And these can be animal foods, things like cheese and meat and fish, chicken you can see on the slide, but then there's also many plant foods that we consume that contains protein, and you can see those on the slide as well: lentils, nuts, chickpeas, plant-based protein. And let's not forget, I know that many of you will be vegetarian, and it's absolutely certainly possible to get all of the protein you need from a vegetarian approach. So I just want to, before I move on to the next slide, highlight that many foods and drinks do contain protein. And I say drinks because I've got milk on that slide as well. So a drink that contains protein. Any dairy foods, all dairy foods contain protein. But we know that there isn't, the advice is for you to take your levodopa medication not at the same time as you consume any of those foods that I had on the previous slide, simply because When you take food that contains protein, it gets broken down into amino acids. If you think of a Lego house and think of all the individual bricks of Lego, they're the amino acids that make up protein. And those amino acids, when they go into your intestine, compete with the levodopa for absorption. So it happens both in your intestine and it also happens in the brain. So when the levodopa, if it does get absorbed, it goes into your bloodstream and then it makes its way up to the brain. And the second place that there's competition between the protein or the amino acids in your food and levodopa is at the brain. We don't want that to happen because we want the levodopa to get it into the brain to do its thing. So the advice is to take your levodopa about 30 to 45 minutes before you have a meal, simply because you've got an empty stomach then, a meal or a snack. It's better to take your levodopa on an empty stomach so it can get absorbed, and it can get absorbed in the intestine and in the brain, and it's not competing with the protein in your food. And that's just something that again comes up time and time again when I talk to people with Parkinson. So that's the advice around protein and the levodopa medication that you take. Okay, so now moving on to the third thing. And again, just thinking of those 3 key points that you might take away from this presentation. One of them might be around, oh yes, I must remember when I'm taking my levodopa, I shouldn't have it with a glass of milk, because a glass of milk has protein in it, so I'm going to have it with a glass of water. Or just to remember, oh yeah, I must set maybe a little alarm to remember to take my levodopa, those, 30 to 45 minutes before your meal. So that might be one of the key points you take away from today, just as an example. All right, so we're going to move on to the next thing, and that's to do with your gut health. So we know both from speaking to people with Parkinson's, and I know that from the research that I read online, that constipation is a really big problem. I have written on the slide here, affects more than 50 people with Parkinson's. In some instances, it's more than 50%. So 1 in 2 of you in the room today. In actual fact, it affects even more than that. So, but even 80% of people with Parkinson's at some point or other find constipation is a real problem. One of the things that you can do, and again, this talk today is really all about giving you tips and tricks of things that you can do to help manage the symptoms you have, is to incorporate some foods that are on the slide that have dietary fiber. And of the foods on this slide, I've only got a handful there, but you'll see fruit and veg, you'll see some whole grain bread, you'll see porridge oats. And in general, people in Australia and in New Zealand and in Ireland, where I'm from, most of the population don't eat enough fiber every day. So it's not just people with Parkinson's. Most people in Australia don't eat enough fiber. We know that from the big national dietary surveys in Australia. And most people with Parkinson's don't eat enough fiber. So there is room for you to make a change or two, really, to help with your gut health. So the next few slides, I've got some top tips that you can maybe use to incorporate a little bit more fiber into your diet. And again, that might be one of your key points that you're going to take away. So for instance, you could add some more fruit or nuts or seeds to your breakfast cereal if you're a person that has breakfast cereal or yogurt in the morning. When we talk about fruit, and I know at different times of the year, depending on the season, fruit can be really expensive. It doesn't matter if the fruit you choose, it can be frozen, it can be from a tin. I often have tinned fruit for my breakfast and I put it through the colander to wash away the syrupy stuff, but it's fine to have frozen fruit, tinned fruit, dried fruit, absolutely fine to have and to choose the fresh fruit when it's in season and when it's not so expensive. Extra vegetables. So if you're making, I don't know, a bolognese or a curry or a chili, you can buy tinned lentils and just drain them off in the colander, and then you can pop them into your bolognese or what have you. So that's adding extra vegetables, which have protein in them. Peanut butter, another, just a suggestion of a snack that you could have peanut butter on celery. And again, you're adding additional protein. Pardon me, you're not adding additional, well, are adding additional protein because there's protein in the peanut butter, but you're also adding extra fiber. Those of you who bake, you might consider swapping your white flour for a sort of a whole wheat flour. Those of you who eat pasta, rice, those kind of foods, you might swap the white variety for the wholemeal variety. And then again, if you might have crackers at home, you could swap those for the more grainy ones. So finish what you have in the cupboard, but next time you go to the supermarket, you could just consider some of these swaps. And then finally, I've got a try to slide, keeping a supply of frozen vegetables in the freezer, for instance, whether that's a bag of frozen peas or whatever your frozen sweet corn, whatever is your favorite is, keep in the freezer so there's kind of no excuse to have some vegetables on the plate or some, this could be some tinned vegetables, for instance, leaving the skin on vegetables and fruit that you eat. And sort of remembering this whole thing about 5 portions of fruit and vegetable every day. It's really hard to do it every day. And the general population in Australia does not have 5 portions of fruit and vegetables every day. That's what we aspire to, isn't it? That's what we try to do. The trick to remember also is if you come away from today and you think, right, I'm gonna use those couple of tips and tricks that were described, that Fiona talked through, don't do it all at once. Because if you really increase your fibre intake quite a lot from one day to the next, you might find you get a bit constipated. So just if you're going to incorporate some of these tips and tricks, just do it a bit at a time. But all of these are really useful tips for you to take away to really help with the constipation that many of you I know it'll be bothersome, it'll be decreasing your quality of life, it'll be affecting what you eat, it'll be affecting your ability to go out and about and meet your friends. And these are really important things that we want to avoid. And the final point on my slide there is to remember to drink a good amount of fluid as you begin to increase your fibre intake. And that fluid might be, water, or it might be, I mentioned, a sugar-free drink, it might be tea, it might be milk. All of those are absolutely fine. They're all sources of fluid. One of the questions that came through is, what about tea and coffee? Nothing wrong with tea and coffee. I know in Australia you love to have a good coffee. Tea, all good, all contributing to the fluid that you consume. Okay, I'm going to move on to the next part of the talk because a lot of people ask me about, what about the Mediterranean diet? What about probiotics, etc., etc. So I'm going to very briefly just talk about 3 things. I'm going to talk about the whole probiotics and tell you what the latest nutrition science is around probiotic use. And then I'm going to talk about the Mediterranean diet and the ketogenic diet and tell you where the research is around that. So we'll start with biotics. That's the sort of collective name for them. And that comprises of 3 things: probiotics, prebiotics, and symbiotics. So let me describe what those 3 things are. So probiotics are foods that you'll find in the supermarket and the pharmacy and what have you that contain live microorganisms. So you might see a yogurt in the shops and it says contains millions of probiotics. So they're bacteria, what have you, in the food that you buy. Prebiotics are components of the food that you eat that actually feed the bugs that are already in your gut. So we know that we have bugs living in our gut. Collectively, it's called the microbiome. So all of those bugs like to be fed, and prebiotics are foods that you and I eat that actually feed the bugs in the gut. And then symbiotics, that's a combination between probiotics and prebiotics. So hopefully that just sort of, it just explains those 3 terms for you. So there is some research, there's quite a bit of ongoing research, and it shows now that probiotics, there is some promise for them being helpful for constipation for people with Parkinson's. But there's a couple of things I want you just to consider. Number 1, if you're going to take any type of probiotic, make sure you tell your Parkinson's doctor or your Parkinson's nurse, because we don't know yet whether the probiotic in the food that you're taking, does it interact with your medication? And it may do. Number 2, all of the trials that have been done looking at people with Parkinson's and testing a probiotic for constipation, they're a real mixed bag. So the different trials that have been done, the different clinical trials that have been done, they give people probiotics with different bacteria in them, different doses. So some trials give a big dose to the participants in the trial, some trials give a smaller dose. the route of administration. So some of these trials use capsules and powder, and then the thing they compare it with in the trial can be different from one trial to the next. And you're probably tearing your hair out and thinking, why do these researchers why is there such heterogeneity between the trials? This is what it's like in research. And I just want to highlight that, yes, while there's promise for constipation, we do need more consistent trials being carried out, and we do need trials of longer duration. So if you're going to take a probiotic, please talk to your Parkinson's doctor and your Parkinson's nurse about that. And even bring the probiotic with you, and they'll be able to give you some more personalized advice around the medication that you take. What about the Mediterranean diet? Well, I've just got a slide here. Now, you don't need to live in the Mediterranean to eat a Mediterranean dietary pattern, is one thing, although it'd be very nice to live in the Mediterranean. I'm sure you'll all agree. So Mediterranean diet tends to be characterized by fruit and vegetables and whole grain foods. There's a piece of salmon in the middle of the picture, so oily fish. And there's nutrients found in all those foods that tend to be anti-inflammatory and tend to protect the brain, neuroprotective. And there are some trials that have been carried out, sort of, 3 or 4. We're not talking about tens and tens of trials by any means, that have tested, and these are trials in Parkinson's, that have tested the impact of the Mediterranean diet on people with Parkinson's, and they've tested whether it has an effect on cognition or whether it has an effect on your gastrointestinal health. So they haven't focused on movement symptoms, it's more on the non-motor, the non-movement symptoms. And again, there's some promise there. The Mediterranean diet, because it's so diverse and contains foods from all the different food groups, and I'll describe at the end what I mean by a food group, it is a sensible approach. It's very similar to the healthy eating guidelines, the Australian Guide to Healthy Eating. It's full of nutrient-rich foods. It can be made culturally appropriate, so fruits and vegetables and sources of protein that you select can align with your culture. And I also know that all of the foods on this slide are all available to purchase or to grow in Australia. Having lived there, I know that many of these foods or all of these foods are available to you. So there's certainly promise, and it's of all the dietary patterns, Mediterranean dietary pattern is a pattern of foods. It is the one that's showing most promise. I want to talk about the ketogenic dietary pattern because, again, a lot of people ask about this. So just to remind you, ketogenic diet, what it is eating foods that are high in fat, low in carbohydrate, and essentially the neurons in the brain that are adversely affected in Parkinson's use the what are called ketone bodies, which are produced as a result of eating in this way. So some trials have been carried out, small trials of the ketogenic diet in people with Parkinson's, and they've examined motor symptoms and they've examined non-motor symptoms like anxiety and voice. But most of the data from ketogenic studies and trials is mostly from animal models. And I think there is promise to this approach, but we're really quite far away from having enough evidence to recommend a ketogenic diet in Parkinson's. There are some safety concerns, like I've highlighted here on the slide. It may be associated with not getting enough vitamins and minerals. It's high in saturated fat, and saturated fat increases our risk of heart disease, for instance. So I think while there may be promise, we're quite far away from having enough evidence to recommend this. And then the last bit I want to talk about on the Mediterranean diet is the fact that some people in Canada, a research group in the west coast of Canada, have just completed a trial. Now, they haven't released the results yet, but they've done a trial in Parkinson's where they've combined Mediterranean diet and ketogenic diet. And they're testing the effect of that combination on gut health. You remember I talked about gastrointestinal or gut health can be an issue. And so as I say, the results aren't available yet. I was able to get some preliminary unpublished results, and the website is there. and it says it's safe, but adherence, people found it very difficult to adhere to this particular combo. So once the results are available, I can come back the next time. If Tricia invites me, I can come back the next time and tell you what the results are. So to finish off, what can you do today? What changes can you make? What 3 things can you, 3 points from today can you put into action? So I'm going to talk through very, very, in the last few slides, what those things might be. And we've touched upon them, and I just want to bring it all together. So this picture is the Australian Guide to Healthy Eating. And if you wanted to Google it, you could find it. But essentially, each segment in this circle is a food group. So top left with the orange rim, they're grain foods. So, grainy carbohydrate foods, so pasta, bread, couscous, rolled oats, those kind of foods. So what I want you to consider is when you go for your carbohydrate foods, to choose the ones the high fiber varieties, because we talked about constipation and the importance of those sorts of foods for gut health. And then on the right hand side with the green, you'll see vegetables and fruit. And people say to me, oh, Fiona, don't make me eat a banana. I hate bananas. I don't mind. You can choose whatever you like in terms of fruit and vegetables. We all have our likes and dislikes. As long as you're getting plenty of fruit and vegetables in every day, doesn't matter whether it's frozen or tinned or comes in a jar or what have you, that's absolutely fine. And then bottom left, it's those protein foods. And again, it doesn't matter if those protein foods are from plant sources or animal sources. And then what you can see is here we've got dairy foods. So dairy foods being milk, yogurt, cheese, they're the foods, or the alternatives. So people who choose not to have animal sources, you can have, soy milk or rice milk or oat milk or whatever it might be. Just the nutrients in those dairy foods and the alternatives, the really important nutrients for you is calcium, because it's really important for your bone health, because we know in Parkinson's, your risk of osteoporosis can be higher. So having some calcium foods every day, and that might be a case of having instead of having a coffee made with water, you might choose to have a milky one, like a flat white or a latte or something. Or you might say, well, from now on, I'm going to have a yogurt for my lunch. So dietary diversity, making sure you have foods every day from each of the different food groups. And the food groups, as I say, that's the Australian Guide to Healthy Eating and those food groups right there. Secondly, and we've touched upon this, fiber-rich foods, and I've put an extra circle around which foods those are, and we've talked about plenty of tips around that. And then finally, maintaining a healthy weight. And so check with your GP, check with your Parkinson's doctor, consider, you think to yourself, gosh, have I been losing weight? And that's something I really want to, see if I can do something about. Often it's difficult to gain the weight back on when you've lost weight with Parkinson's, but even if you can sort of stabilize it. And as I say, you might not have a scales at home, which is fine, but every time you go to your GP or your nurse, insist that they pop you on the scales. It only takes them a couple of seconds. They'll all have scales in their clinics, and you can say, well, look, the dietitian said you need to weigh me each time so that we can see if there is change over time. And that is really important, and they'll be able to tell you what a healthy weight is. There's lots of useful resources online, and if you like Tricia, I can send these across to Tricia and she can maybe make them available to you. There's booklets from the Michael J. Fox Foundation and Parkinson's Europe and America and what have you, so I can send these across to you if that would be helpful. So like I say, before you leave today, before you leave at the end of the day, chat with the person next to you and think, well, what are the 3 important points, 3 key points that you're going to put into action? And even if you think, oh my goodness, 3 things, even if you make 1 change after this talk and do it consistently, well, that's a win as far as I'm concerned. That would be amazing. So I just want to say thank you very much to my colleagues on the top right. We're a research life course nutrition group based at the University of Auckland. I collaborate with people all over the place in the UK. I've got my colleagues here at the University of Auckland. The Health Research Council funds some of our research. Participants who take part in research, I want to say thank you to those. And there's my email address, and I'm very happy to hear many of you. So I'm gonna stop talking now and hand it back to the MC.
Oh, thank you so much, Fiona. Interestingly, Fiona, this MC writes cookbooks, so I was sitting down there going, ooh, very, very interesting. We've got a couple of minutes. Are there any questions on the floor while we've got someone as clever as Fiona online? Down the front here. Thanks, Fiona. We've got a question coming up. Alrighty.
Good afternoon, Fiona. How are you going?
Good, thank you.
Just looking at macro goals, your carbohydrates, your proteins and your fat, what do you consider to be a reasonable percentage for each of those three for people with Parkinson?
Really good question. So there are no specific guidelines for the percentage of energy from each of those macronutrients for Parkinson's per se, but there are guidelines for healthy eating in Australia. So that would be about 60 to 70% of energy from carbohydrate. But just to consider those carbohydrate foods, to go for the whole grain ones. They're the ones that will give you more bang for your buck because they'll be higher in fiber. Protein is about 12 to 15% of energy from protein. Those are the guidelines in Australia. And then the rest from fat. I guess to remember that as we get older, we need a little bit more protein. So the guidelines in Australia indicate that as we age, simply because as we age, our muscles begin to become less strong and we lose muscle mass. And therefore it's important to consume a bit more protein as we age. So those percentages I gave you were very much general for the population, but change a little bit as we age.
Thank you.
Any more questions? Or we're right on time, actually. So maybe if there are more questions, what we could do, we can forward them through to the park for Fiona and she can get back to you at a later date if that's